Hello and welcome to our discussion on maternal and child health prevention guidelines. These are the learning objectives for this lesson. After viewing this presentation, you should be able to identify the types of organizations that create prevention guidelines, describe the process for developing guidelines for preventative clinical services, classify U.S. Preventative Services Task Force recommendations based on the assigned letter grade, illustrate the need for evidence-based public health practices when establishing preventative guidelines, and finally to discuss the role of health literacy in disseminating and implementing preventative guidelines. To begin, let's think about what a prevention guideline is. How do we know what a prevention guideline is when we hear one? To give you an idea, a prevention guideline is a recommendation for a preventative or clinical service intended to improve the overall health or health outcome of an individual. Prevention guidelines are also summaries of evidence that lead to statements about screening policy developed by panels of individuals from different disciplines. Now that you have an idea of what a prevention guideline is, go ahead and watch this video, which follows a woman deciding whether or not she should get screened for breast cancer as recommended by her doctor. As you're watching, write down your thoughts and initial reactions. Once you've finished the video, here are some things to consider. What kind of screening did Lisa's doctor recommend for her 40th birthday? Whom does she consult with in order to reach a decision? What kinds of factors increase an individual's risk for breast cancer? Did Lisa consider any risks that may be associated with mammography screening? And what was the overall message of the video about prevention and screening? National organizations and professional medical societies review and publish prevention guidelines every few years or as needed. The guideline recommendations are updated to reflect best practices based on current scientific evidence. Let's first take a look at the federal agency disseminating prevention guidelines, the U.S. Preventative Service Task Force. The U.S. Preventative Services Task Force is authorized by Congress in 1984, and it's an independent group of healthcare experts from a variety of health-related backgrounds, such as behavioral health, gynecology, pediatrics, and nursing. The 1998 Public Health Service Act and the 2010 Patient Protection and Affordable Care Act assign the Agency for Healthcare Research and Quality with the role of providing administrative support for daily operations, research, and dissemination activities. Similar to the U.S. Preventative Services Task Force, other organizations create prevention health guidelines that may differ from those recommended by the task force. Examples of organizations that also create guidelines for maternal and child health are the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, and the American Cancer Society. Each organization forms councils of specialist clinicians to routinely update their guidelines by reviewing recommendations from other organizations, such as the task force, and drawing upon expert opinion. One example of this is the American College of Obstetricians and Gynecologists, which convenes several committees of member clinicians from women's health care to perinatal care in order to develop and disseminate guidelines. In the next few slides, we'll discuss the guideline process for the U.S. Preventative Services Task Force and take a look at some of the current recommendations for maternal and child health. Since 1998, the Agency for Healthcare Research and Quality has been authorized by the U.S. Congress to convene the task force and to provide ongoing scientific, administrative, and dissemination support. When the task force is convened, they begin the process of developing new recommendations and updating existing ones. The guideline process allows for input from the public, collaboration with experts and stakeholders, and examination of current evidence-based research. By the end of the process, the task force disseminates recommendations which can be used by physicians and patients to make informed healthcare decisions. The first step in the guideline development process is topic nomination and prioritization. Topic nominations or updates to existing topics can be submitted to the task force website. The topics are then prioritized based on relevance to prevention and primary care, importance to public health, potential impact, and whether new evidence warrants an update to the existing recommendation. In the second step of the guideline development process, a research plan for each topic is drafted and then posted to the task force website for public review and comment. After 4 weeks, the task force and researchers from an evidence-based practice center make revisions to the research plan based on public comments. Once the plan is finalized, it's posted to the task force website. Next, the evidence-based practice center's researchers draft several evidence reviews or summaries of the current literature based on articles from peer-reviewed scientific journals. The task force members will then review the evidence reviews to determine the potential benefits versus the harms of a service and a draft of a recommendation statement. Both the draft recommendation statement and the draft evidence reviews are posted online for 4 weeks. Task force members and the researchers from the Evidence-Based Practice Center read over and consider all comments submitted for the draft evidence reviews and draft recommendation. Once the draft recommendation and evidence reviews are finalized, they're posted to the task force website and published in a peer-reviewed scientific journal. Let's look at the guidelines for women's preventative services currently recommended by the U.S. Task Force. The Task Force offers several recommendations regarding cervical cancer screening, but we'll focus on the 2 featured here. The first guideline recommends Pap smear screening every 3 years for women aged 21 to 65 years. This recommendation receives an A grade, indicating Pap smear screening for cervical cancer is very beneficial for this population and outweighs any associated risks. The second guideline does not recommend Pap smear screening for women younger than 21 years. Compared to the first recommendation, the second received a D grade, indicating Pap smear screening in women less than 21 years would pose more risks than benefits. Mammography screening is another popular prevention screening in women's health, since breast cancer is the second most common cancer among women in the U.S. The task force recommends biennial screening mammography for women aged 50 to 74 years. It was assigned a letter grade of B, indicating the health effects of mammography screening for women in this age range are mostly beneficial, but there still may be few risks or harms to the patients. It's important to emphasize that the guidelines created by the U.S. Task Force and similar entities are recommendations for preventive services. Each individual is different and needs to assess their personal health history with their healthcare provider to come to a final decision. An overarching goal in public health is to have evidence-based recommendations. By having guidelines for recommended health services and behaviors, we can work toward reducing health disparities and improving overall quality of life, especially for vulnerable and disadvantaged populations. Recommendations provide clinicians guidance in informing patients of preventative services that may help them avoid disease and the associated treatment costs. As the price of healthcare continues to rise, guidelines offer patients an affordable way to monitor their health status as they age, thereby preventing major diseases that are expensive to treat. Health insurance companies are also required under the Affordable Care Act to cover preventative services such as those recommended by the U.S. Task Force at no cost to the individual. So we keep using this word, evidence-based public health, but what does it mean? Evidence-based public health is the development, implementation, and evaluation of effective programs and policies through the application of principles of scientific reasoning. Recommendations for screening or other prevention practices should be based on research or scientific evidence. Research that is evidence-based or proven to be effective can therefore provide reasoning and support for the preventative service. There are some issues in public health when it comes to disseminating and implementing recommended guidelines for preventative services. These issues affect not only the public and patients, but providers as well. For example, when a guideline changes, the information is disseminated in peer-reviewed scientific journals. Primarily, guideline evidence reviews are written for healthcare professionals to inform their practice. Both the evidence reviews and guideline recommendations are full of technical terms that are often unfamiliar and difficult to understand for anyone outside of the medical profession. Another issue with implementing guidelines is understanding and communicating the rationale for changes. Recommendations for preventative services are routinely updated by the task force based on current scientific evidence. If the evidence for a preventative service indicates there is more harm being done than benefits received, the grade may be changed. Providers may agree or disagree with the changes, which affects the advice they give to their patients. Patients may also become confused and have difficulty understanding why the recommendations changed and how it will affect them. Lastly, preventative service guidelines are not consistent and differ depending on where one goes for information. Take a look at the linked YouTube video to see how this difference creates confusion for patients seeking clear and reliable health information. As stated in the previous slide, guideline dissemination and implementation is not perfect, but how does it affect the screening practices of women's healthcare providers? In 2009, the American College of Obstetricians and Gynecologists significantly changed the screening guidelines for cervical cancer by recommending less frequent screening. Several years after the recommendations had been publicized and disseminated, a group of researchers set out to assess physician adherence to the 2009 cervical cancer screening guidelines. In this study, different types of physicians who might perform cervical cancer screenings were surveyed. These included internists, family physicians, and gynecologists. Let's go to the next slide and see what the results were. Physician non-adherence was defined as screening when it was not recommended for the age group or performing part of the recommendation. For example, if the woman was under 21 years of age and screening occurred. Another example is if the woman was over 30 years of age and the physician only screened with cytology, although cytology in combination with HPV testing is recommended. From the study, they found overall physician adherence was low, with 34% of physicians for women under 21 and 49% of physicians for women between ages 30 and 65 not adhering to the guidelines. The results also revealed only 22% of physicians adhered to cervical cancer screening guidelines for women between the ages of 21 and 29 years of age. Researchers stated that the most likely factor contributing to this low adherence among providers was a lack of awareness regarding these guideline changes. Providers were screening more frequently than recommended and exposing women to unnecessary testing. A critical factor affecting an individual's adherence to recommended screening guidelines is health literacy. Health literacy is the knowledge, motivation, and competencies of accessing, understanding, appraising, and applying health-related information within healthcare, disease prevention, and health promotion settings, respectively. There is an increasing body of research recognizing the value of health literacy for a patient's access to health services, ability to navigate the healthcare system, evaluate health information, and make health decisions. The healthcare system and public health professionals also play a role in increasing the population's health literacy, which will be discussed in a later slide. Health literacy is not simply about knowledge. It's a skill that needs to be developed. Individuals across income and education levels are affected by limited health literacy, although some groups are more at risk for low health literacy, such as older adults, racial or ethnic minorities, non-native speakers of English, individuals who have less than a high school education, and individuals with lower income. Health information can be overwhelming and confusing, especially in stressful situations. Without the ability to process or understand health information, individuals are less likely to use clinical preventative services like screening. Low levels of health literacy are associated with an increased number of hospital stays, mismanagement of chronic conditions, an increase in preventable hospital visits, and higher mortality rates. One way to improve adherence to prevention guidelines is to address dissemination and implementation barriers for providers and increase the population's health literacy. For patients, health information needs to be communicated clearly and with limited use of technical terms. It is the responsibility of public health and healthcare professionals to alter health messages and engage patients in health literacy skill building. By increasing health literacy, the patient population will be empowered to know what guidelines are recommended for them. The federal government has also created guideline tools where an individual can learn about and get personalized recommendations for preventative services. An example is My Health Finder, which we'll see more about in a couple slides. Providers also need to be informed of guideline changes. Several strategies have been employed in different settings to varying degrees of effectiveness to increase guideline dissemination. Some examples are educational meetings, distribution of educational materials, and consensus meetings where providers in a practice discuss a recommendation and decide whether to adopt the practice. Emails and prompts on electronic health records also serve as a reminder to engage patients in discussion and educate them regarding the benefits of recommended prevention services. In December 2016, the American College of Obstetricians and Gynecologists formed a cooperative with several other professional health organizations and societies called the Women's Preventative Services Initiative. It is comprised of more than 20 national health professional societies, consumer organizations, and federal partners, including the American Academy of Pediatrics, American Cancer Society, Centers for Disease Control and Prevention, and the Office of Minority Health. The aim of the Women's Preventative Services Initiative is to develop, review, and disseminate recommendations for preventative services for women. There are a few key differences between the Women's Preventative Services Initiative and the U.S. Preventative Services Task Force. First, let's go over how they're alike. Similar to the U.S. Preventive Services Task Force, the Women's Preventative Services Initiative develops guidelines by drawing on expert opinion, reviewing evidence-based research, and soliciting input from the public before finalizing and publishing recommendations. But what sets them apart? The Women's Preventative Services Initiative only develops guidelines specifically for women. The guidelines are also uniform, meaning the participating organizations will adopt and promote the recommendations for consistency and to minimize confusion for patients and providers. Patients and consumers are represented by full-fledged members who remain present throughout the guideline development process. Finally, by collaborating with community outreach groups, the initiative will actively disseminate the recommendations and increase awareness of the need for preventative health care, especially among disadvantaged populations. So here is one example of a guideline tool available online for the public. Anyone can navigate to My Health Finder website to find out which preventative services are recommended for them based on the guidelines developed by the U.S. Task Force. Here we've navigated to healthfinder.gov, and as you can see on the right-hand side, there's the ability to go in and check which preventive services you or a loved one may need this year. So as an example, let's put in someone's age and sex and see what's recommended. So if a woman is 65 years of age, let's see what she needs. So doctor recommends that she get tested for hepatitis C, get a bone density test, get certain shots for older adults, get tested for breast cancer with a mammography every 2 years as recommended by the U.S. Preventive Services Task Force. She should also get a pap test every 3 years and screened for HPV every 5 years. Other tests include colorectal screenings, blood pressure, cholesterol, a well woman visit, and she should get help for quitting smoking if she's doing so, as well as talk to her doctor about depression, watch her weight, and get tested for HIV. As you can see, if a woman wanted to know more about this particular topic, she could click on one of these and it would bring her to more information about that particular test. Thank you for watching this presentation on prevention guidelines. By now, you should be able to identify the different types of organizations that create preventative guidelines, such as the U.S. Prevention Task Force, as well as other professional organizations. You should also be able to describe the process for developing these guidelines and how they're assigned letter grades. You should also be able to illustrate the need for evidence-based public health practices with establishing preventative guidelines, and discuss the role of health literacy in disseminating and implementing preventative guidelines.